Stress fractures develop in response to repetitive microtrauma. Intense exercise often induces bone remodeling. A sudden or substantial increase in duration or intensity of training is the most significant risk factor for stress fracture development. Inadequate muscle strength, lack of flexibility, and low bone density also contribute. Athletes generally complain of focal pain over a bone, often occurring in the femur, tibia, or long bones of the foot.
A femoral neck stress fracture occurs deep within the hip or in the front of the groin. Somebody with a femoral neck stress fracture may limp, and it is often so painful they cannot do things like running or climbing stairs. For a tibial stress fracture, some common signs and symptoms include shin splints and swelling in the area of the fracture. A stress fracture of the metatarsals usually shows signs of localized pain and swelling. Activity and percussion of the toes will cause pain in the area of the fracture.
What causes a stress fracture? One common cause of stress fractures is switching surfaces without decreasing work intensity on the new surface. For example, if you train on grass and then switch to a hard surface, this will cause stress and strain on the muscles of the lower leg, such as the tibialis muscles. When you switch surfaces, you should gradually increase the intensity of your workout in order to avoid putting too much stress on the tibialis muscles.
Who are at higher risk? Women are up to 10 times more likely to develop fatigue fractures than men. Hormonal changes may make women athletes' bones more likely to fracture, as well as eating disorders, which are more common in women athletes. Marathon runners are also at high risk due to high-intensity running on hard surfaces. Prevention. Stretches to help prevent stress fractures include calf stretch, heel-toe walking, which is in the walking motion of heel-heel, toe-toe, and thermoband stretches, where you place the thermoband in the arch of the foot and dorsiflex, like pushing your foot on a car pedal.
Other ways you can prevent stress fractures are by getting sufficient rest and recovery in between workouts, wearing proper footwear, and having a healthy diet. Proper footwear includes not wearing flip-flops or worn-down shoes. Instead, new running shoes should be worn and replaced every couple of months. Proper diet includes eating balanced meals every day. A variety of fruits and vegetables should be eaten, and calcium should be taken in to help promote bone health. Candy and fast foods should be eaten in moderation. If you stretch, switch surfaces with caution, wear proper shoes, have a healthy diet, and get sufficient rest, your risk of developing a stress fracture will be reduced.
How are they diagnosed? What is the treatment? Stress fractures are diagnosed through x-rays and MRIs. The arrows in these x-rays indicate the location of the stress fracture. Treatment for stress fractures include engaging in pain-free activity for 6 to 8 weeks, being placed in a non-weight bearing below-the-knee boot, and a femoral neck stress fracture should be treated with crutches to help keep the weight off the hip.
After 4 weeks, the stage of healing should be assessed. If it is not healed, a decision must be made about whether to continue in the cast, remove the cast, or proceed with surgery. When healed, in-shoe orthotic devices may help redistribute the forces and prevent a recurrence.
Preventative measures should be taken in order to avoid the development of a stress fracture. If you suspect that you might have a stress fracture, see an athletic trainer or orthopedic physician as soon as possible.